Hi, I'm Ginille, Cosmetic Nurse Practitioner since 2013. I don't have too much time to chat tonight because I got to go wash my hair, but we can talk through questions you have. We can talk through Botox, filler, skin treatments, hair treatments. I have 3 practices, Jossie's Skin and Wellness Clinics. You can find us in Los Angeles. You can find us in Mar Vista, Torrance, and LA. And then you can find us in Las Vegas on the Summerlin side. So right now I'm kind of swollen because yesterday I did some of the natural filler into my smile lines, my temples, lateral part of my eye, and around the sides of my mouth. So I'm swollen. This is what it look like if you're swollen. I feel like my smile lines just look like extra puffed out. Usually with the natural filler. So natural filler is when we draw blood from your arm, we spin it in the centrifuge, and it separates out your growth factors and stem cells. We take that, we heat it and cool it so it makes a gel, and wherever we inject it, it's going to make new collagen over time. So I'm still breastfeeding a baby. He's 2, and I cannot do traditional filler. I can't do any treatments right now because I'm breastfeeding. So the natural one I can do because nothing else is mixed inside of it besides your own blood's growth factors and stem cells. So this is what it looks like. It's going to make new collagen over time. It'll look a little overdone, kind of like this. Hey, Perla, I hope you're doing so good. Like this for like 3 to 5 days, and then it settles. Tomorrow I've got patients. Whenever I do it, my patients are like, I don't even see it. What are you talking about? But I'm like, oh, I see it. I feel a little self-conscious. I have a little bruise here. I did some along my jawline to connect the chin to the jawline. As we get older, fat pads start to separate and sink, and we'll get a little jowling. So I'm just trying to camouflage some of that. But I really like the natural filler. I don't even know if I'm going to go back to using traditional filler, even though I love it and I've used it a lot over time. This is me before I ever had anything at 28 years old. This is me. This is after I had done fillers with me like a few years ago. But I really do like the natural one. If you're okay with waiting and you don't need instant results, I'm like, do the natural one, especially if you're like 20s to 40s, even 50s. I'm like, if you're okay with waiting, you don't have a ton of volume loss, you're trying to be more preventative, go the natural way. There's not, I mean, you're going to be a little swollen. Like I said, I'm swollen right now. It's like I feel sore wherever I had it injected. But it's just like a few days of that. It's not temperamental the way traditional filler, it takes 2 to 3 weeks of swelling, and then it takes 6 to 8 weeks for the filler to completely settle and integrate. So the natural one is PRF EZ Gel. That's just like the brand of the centrifuge, the spinner, and the heater that we have. But what we do is we take out blood from you. So we draw 2 tubes of blood, it spins in the spinner, and then it separates out your platelet-rich fibrin and platelet-rich, platelet-rich, goodness gracious, can I think PRP, platelet-rich plasma, and your platelet-rich fibrin. So that has like growth factors and stem cells in it made from you. And then that is going to help make new collagen wherever we inject it. So we heat it, we cool it, we inject it. Like I did yesterday, this lateral part of my eyes, some into my temples, the smile lines. I feel like pretty swollen right now, corners of my mouth, and then here. I've treated all these areas over the past couple of years since I'm not doing traditional filler, and it does just help me not look so swollen. I mean, so sunken as I was in 10 years ago when I was 28. Someone said, Phoebe said, I'm 31, but I look 26 years old. I want to get more young. I want to look more young. Is PRF going to do the job? So if you already look young, this is what I was saying. I was like, if you're in your 20s to like 40s, 50s, I would definitely do the natural filler if you don't need an immediate result. If you want something quick and overnight, I'm like, it's not the overnight thing. This is one that's like an investment in your future self because it's your body making new collagen wherever we inject it over time. New collagen can take up to 6 months to see the full results. So I see a lot of people, they'll come on my pages when I'm talking about it, and they're like, oh, that didn't do anything for me. I got it and it only lasted for 10 days. I'm like, your provider didn't educate you enough because it's not about the immediate swell. Like I'm not expecting this, guys. If you see me when I'm live in a few days, it's not going to look swollen like this. I know it's not going to stay like that. It's going to look almost like I didn't really do too much. That's normal. It is progressive over time that you will see the improvement. So I have to like really try to educate people. I'm like, it's not the immediate swell that we're going for when we're doing this. We're going for the long-term game when we're doing the natural filler. If you want instant results, that's where you can go with the traditional filler if you're the right candidate. Also, if you want something like really angular or more structured, that might be more of traditional filler. In the United States, we have several FDA approved, traditional fillers, and we can choose different ones. They have different properties. Some are thicker, some are thinner. So I use different ones in different parts of the face in a different person. Somebody that has like more fullness in their face, more fat in their face, I need a thicker product. So if you want more control over like the exact outcome, if you want a quick outcome, if you want something really structured, that's when I would say go with regular filler. If you're more trying to be preventative, you don't have a ton of volume loss, you're just trying to think about the signs of aging, and that's really how we inject at the office, is like thinking underneath the skin, where we lose bone, where we lose fat, that's where we inject. If you're thinking more preventative, I'm like, go the natural one. I think it's so wonderful. I'm saying that after having only been doing that for over 2 years, because I'm breastfeeding a baby and I haven't had any regular filler for the past over 3 years. Okay, let's see. Any advice for lasers to lighten a dark neck from insulin resistance? So first thing is going to be like trying to get insulin resistance under control. Second thing you can do is sunscreen is going to be a big one. Lasers, Aerolase laser is great and it's safe for all skin types, all skin tones. That can help with pigment, as well as the bio repill chemical pill, I think is really nice. There's no downtime with either of those. So those are great. But the biggest thing is going to be like working on the insulin resistance. Okay, let me see if there's others. I'm trying to make sure I hit any questions up. I'm not going to be on too long tonight. Oh, Ashley said, are there any natural lip fillers? So you can do that natural, that same one I was talking about where we draw blood from your arm. We can inject that into the lips. So I've injected it all over people's faces. And I told you yesterday, I did my temples, my eyes, a little part of my cheeks, the smile lines, the corners of my mouth, this. I did like my whole face yesterday. Like very small amounts in these areas because I just saw teeny little shadows. Like it wasn't anything major. But I have done people for their lips. I tell them, I'm like, it's not going to give you these huge, juicy lips. It's not overnight. It's not going to give you super defined borders. If you want like quick, if you're like, oh, my lips feel deflated, I want it right now, go with your regular filler. If you want like more definition, like crispier borders, go with your regular filler. But if you're trying to just get like a little bit of volume, you don't need it overnight, nothing crazy, you can go with a natural filler. We will continue to lose collagen, guys. Like in our mid-20s and going on, we just keep losing collagen. So people, as we get older, they start to notice their lips start to get thinner and wider, and the lips corners start to curl in, and then they get these deep little lines here. So yes, you can use this to help with new collagen in those areas. Okay, let me see if I'm missing any. I'm just gonna make sure I can do it. Okay, educate me on laser for stretch marks and scars, my biggest insecurity. Hey Phoebe, so stretch marks are hard to treat. Couple things you can do. If they're like really old, it's harder. If they're newer, the newer they are, and the lighter they are, the easier. The longer they've been sitting in there, the longer it's going to take to like treat them. You can do skin pin microneedling, I think is really good to work on skin texture, and then do the chemical pill, repill chemical pill at the same time as doing your microneedling. So you can do that. That'll help with skin cell turnover. That'll help with the texture, and that'll help with lightening them with the color. So that's really good. Other things are, again, staying out of the sun. You don't want to get sun on these areas, or it can make them darker, and then just like stay hydrated. Hey, I hope you're doing so good. I saw you earlier talking to my mommy, helping her. Okay, let me see. Okay, if there are other ones, I'm just going up and down and going to answer them. And let me make sure. So that's for stretch marks. Start treating them earlier. Other things are just like hydrate, moist, like try to keep that area moist. I have 3 kids. I did not have stretch marks until my last one. I mean, I only have like a little tiny bit of line, but that last one, I did not like stay moisturized. I would scratch my stomach. Like, don't do that. Don't do those things. Okay. Hi, Rita. I hope you're doing so great. I'll see you later. I know my mommy's probably hanging out with you too. Okay. Do consultation fees go towards a treatment? So yes, they do. We do virtual consults for I try to do it for everybody, or me or my team, before you come in, so we can go through your questions, goals, tips on what to expect, how to prep for treatments, so that you're ready when you come in. A lot of people are coming in from outside of LA, outside of California, outside of the States. And so we want to just make sure you're a good candidate for the treatment. We want you to start preparing for it so you can just have the best possible outcomes. We want to make sure that you have the timing is right. So the virtual consults are $150. That price goes towards your treatment if you do treatment within 3 months from the time we do your virtual consults. In-person consults are $350. That goes towards your treatment that same day if you do treatment. If you don't, it just counts for your consult for the day. But majority of our patients do the virtual consults before they come in. So again, they can just be prepared because they're kind of like, oh, I know I want to do this. I've been watching you. I've been making videos on here every day, guys, for over 5 years. So I know I want to do this. I'm ready. I've watched enough videos, but I still will go through all the things just to make sure you're prepped. You're taking your arnica, you're taking, you're avoiding blood thinners, avoiding alcohol, eating pineapple, you're stopping your active ingredients before you're getting your skin treatments. We just kind of talk through everything. We can send you a treatment plan. We can send you pricing, all the things so that you can get prepped. We also have a lot of people like, how much does this cost? I'm like, I can go through all of that, but on our website, I try to just be super transparent about stuff. So we have pricing on there so you can just kind of know what this is. Now, I can't give you exact pricing for you until I talk about you, until I see you, but we give you pricing ranges based on what we discuss. Okay. Judy said, great, thank you. I'm going to schedule. Oh, I'm so excited to talk to you. Right now it's between me or one of our nurse practitioners, Samantha. She's excellent. She's in our Vegas clinic and we both do the consults. We just get a lot of consults, so I can't do them all. She is amazing. You guys will love her. Sometimes we're like, oh, I wanted to go see Ginille, but now I want to talk to Samantha. I'm like, I know, I think she's really great. Okay, other things we can talk about. So in our office, we treat all skin types, all skin tones. I can flip through patient pictures and show you who they are. It's just some of the patients who've consented to photos, but we really focus on natural looking results. We focus on skin health, hair health, and safety. That's like a big thing. I'm going to do PRF this week. Is it possible to see slight improvement in 4 weeks' time? Maybe a little bit. Other things, you do the PRF, make sure they're heating it and cooling it. Like make sure you're doing the PRF gel, not just a regular PRF. So if they're doing the regular PRF, we spin it and then they take out your growth factors and stem cells and they inject that. But the heating it helps it to hold in the skin longer. And not everybody does that. So it holds in the skin longer. You'll see a little bit more of an instant lift with that. And it makes those growth factors that we inject stay in the skin longer, as opposed to just injecting as just regular liquid. And we do this in a minimum of 2 sessions. So we have you come back in a month and we retreat the same area. Sometimes by a month, people are like, oh yeah, I can already see it. I'm like, shoot, I can see it too. Like I can see it on the photos. I can see like when I walk in, my eyes really go to like shadows and depth. And I'm like, oh, like your eyes, like you look brighter, you look more lifted. That hollow is not as much. And they're like, I know. So some people will see it by that before they come for their second treatment. Other people, when they come back, like, I don't see it yet. I'm like, I know. It can take up to 6 months for the full results. You should be seeing something by 6 weeks. But again, healthier you are, the better the outcome. So we try to say like healthy diet, hydrate, don't smoke, drink, like doing all these crazy things. I'm like, we want your body to have a good environment to make new collagen. So that's something to keep in mind. The healthier you are, the better the outcome. But I have people that will come in and they'll keep doing it because they start treating other parts of their face. So they might start with like their under eyes and smile lines. And then later they're like, oh, actually, can I do this? Can I do this? And I'm like, yeah, you totally can. And then some people come in and they do their all the parts of the face. Like I said, temples, like I did eyes, smile lines yesterday, corners of my mouth, chin here. Some people will do it all in once, but we draw double the amount. So instead of drawing 2 tubes, we're doing 4 tubes. So we usually get about 5 syringes worth, 5 or 6 syringes worth to like inject. We'll get like 10 to 12 to inject all over their face. So then we can just treat more areas. If you take those 5 syringes and you try to like spread it too thin, I'm like, you're not going to see it. So usually if you're just drawing your regular 2 tubes, we can treat like 1 to 2 areas. If your eyes are really deep, if someone's eyes are super hollow, I'm doing all of it underneath their eyes. If their eyes aren't super hollow, I might be doing their eyes and the smile lines. So it just depends on the person and what's going on. So yeah, like if you're really hollow, for people that have lost a lot of volume, I'm like, you're gonna need more. Or if you want to see that instant result, that instant feel that you want it to keep there, do traditional filler. So this is why we just talk through about you and your goals and what's going on and everything before we completely decide. But I really like it. I don't think I would have loved this treatment, guys, if I was not in the position of breastfeeding, because I probably would have just used filler. I would have been like, I don't see a change. When I first did it, I brought it on because patients had been asking me for years, like, can we do this? Can we do this? I'm like, dude, this takes so dang long to see. Like, why are people asking me for this? Like, if they're coming to me, they want to see the result. Like, come on. And I can't guarantee it. Like the result is going to depend on, hey, Kimmy, I hope you're doing so great. Thank you. The result is going to depend on that patient's body to make new collagen. But they kept asking. So I finally brought it on. I had a team. I had like more medical assistants to help me, like, because the processing of it takes like 20 to 30 minutes. So when I first did it, when I was breastfeeding this baby, I was like, I don't see any change. I was like, that was a waste of time, whatever. Over time, I am like, whoa, I never resorted back to, this is pre-filler when I was 10 years ago, and I have 3 kids. So the first 2, I didn't do anything. Like, I couldn't do treatments. This last one, until after I finished breastfeeding, this last one, I started doing the natural filler because it's just from my own blood. And I'm like, I don't look so beat up and haggard. Now, right now, guys, I am swollen. Like, I'm swollen, so it looks a little extra to me. Some people are like, I don't see a change. I'm like, I know I'm like a little puffy right now. But over time, I'm like, I don't feel like this third time around, for having this third baby and being 38 and not 28 and not having any filler for 3+ years. So it works. It takes time. You got to trust the process, and then you got to kind of like be healthy. Like that's a big thing. I'm like, I had a couple patients that were like mid 60s that one lady, she had lost over 100 pounds. And she was just afraid to get regular filler. She's like, I want to do the natural one. I was like, okay. But she was really feeling like self-conscious about her face, because she had like no fat in her face. She was mid 60s, lost a lot of weight. She wanted to kind of see the instant result. When I would do the natural one on her, right when I finished, she's like, I love it because it's swollen. I was like, remember, girl, it's not going to stay like this. It's not going to stay like this. It would go down. She came back. She did her second session. She was like, I like it when it's swollen. I was like, I know it's not going to stay. She came back like shortly after, and she was like, I just want to do regular filler. She's like, I'm not afraid of getting poked anymore. I like when it's swollen, and I don't want to wait. She's like, I'm old. Like, give me the result now. So that's something to keep in mind. Like, I think the older you are, the harder it is for your body to make new collagen. So mid 60s, maybe a little questionable, but yeah, or if you want instant result, go with regular filler. Okay, I'm going to scroll and make sure. What's my favorite pill? I've done the Bio Repeal chemical peel. So I like it because I don't have like crazy peeling. I'm on here making videos and stuff all the time, and I see patients and I wear a mask, and I don't like to be itchy and flaky and dry. And I have little kids, and they're always touching on my face and stuff with their dirty little hands. I love them, and their feet. And they're chomping me on their face. So I don't like to be like super peely. I love the Bio Repeal chemical peel, safe for all skin types and tones, minimal flakiness. And I have a lot of patients that want to peel. So I'm like, if you want to peel, we can make it peel. The way we make it peel is we start stacking it with like microneedling with the laser. I don't like to peel. I've done it with like the laser before. It made me a little too dry, and I started getting flaky. I was like, I don't want to do that. So for me, I like the Bio Repeal with the Hydrafacial. It gives me like extra glow, but I can do the Bio Repeal on its own. I was supposed to do that this weekend, but I think I'm going to do it maybe tomorrow. I have my little cousin that I'm going to see. She's getting ready for her wedding. Okay. When will I be in Vegas again? I think in January. I'm going to see if I can go in December. It just gets so busy. In LA but I'm going to see if I can go in December. But in January, I have to look at my calendar. It's over there. I think it's like the 12th or something. I'll double check. And if you text the number, Erica, my team will tell you. They have the schedule. I have my schedule out for like the first quarter. I'm going to try to make a December appointment over there. I was just there this past Friday, and it was really great. Got to see lots of patients and hang out with the team. It was awesome. And I just do like a quick trip when I'm there. I just kind of like fly in for that day, see the patients, and then I come home before putting these babies to bed. Okay, I'm trying to see if there's other ones. How did you approach your under eye to look fuller? So this is me, 28, prior to doing any treatments. I'm 38 now. And I lost a lot of fat in my face after my first son. He's now 11, sucked all the fat out of my face. And I breastfed for like 2.5 years. So at that point I did filler. So this is me when I've done filler. This is me probably, that red shirt is probably like 2 or 3 years ago. Yeah, I don't think I had my third child yet. I can't remember. I got too much going on, but so I did filler to give me like to help that hollowness and the sunkenness. Now I haven't redone filler besides doing it that time a long time ago. So filler does hang on a long time, especially under the eyes. That's why I tell people, I'm like, if you're going to do under eye filler, see somebody who does it all the time, that they treat people that look like you. They have to be able to make sure that you're the right candidate for the treatment, because not everybody's a good candidate for under eye filler. If you cry a lot, if you've got bad allergies, if you swell when you wake up in the morning, if you're always puffy, anybody that retains water around the eyes, not good candidates for under eye filler. That is another reason why I bought on the natural filler, because I do so many under eyes. I usually am flipping through photos to show you guys, and I can. I treat a lot of under eyes, but then the people that were like, I do have allergies and I get puffy in the mornings, like I almost had like no solution for them. I was like, you can't really do anything. You know, we can talk about a surgical consult, but like they couldn't do anything for the hollowness. But now we have that. So I did filler. I haven't redone filler underneath my eyes besides when I did it, like I said, 10 years ago. The past 2 years, I've been doing the natural filler made from my blood's growth factors and stem cells. So I love the natural filler. I was not a believer at first, and now I'm really a believer. And now I don't even know if I'll go back to like using filler, because if I see something that bothers me now, I just put a little bit of, I get the blood draw, or I have one of the team do it, and I just get some injections there. So you can do traditional filler or the natural filler. Okay, let me see if there's questions that I'm missing. How do I treat patients with under eye bags? Hey, Glowing Grace. I can do a few things. Let me show you some pictures. If they're fat pads that protrude, I let them know I can't take away the fat pad. However, we can camouflage it. So here's a few photos. So here, for her, she's like, I don't get puffy under my eyes, and I never cry and like retain a bunch of, not never, but like, I'm not crying all the time. So I was like, hey, do you want to get surgery? Because surgery can take that fat pad out. It can tighten it. She's like, I'm never going to do surgery, period. She's like, I don't want to do it. So what we did, and this is after one session. When I do the under eyes, I do it in 2 sessions. So hers is actually better. I need to update these photos, but we do filler beneath the fat pad to try to bring the skin, the hollowness up, and try to camouflage it. So that's one. I did that with filler. And here's another one. This one is more like intense, and she has like her selfie she sends me, and she's just beautiful. She's 50 plus, and for her, I was like, get surgery. Like, I can't take that away. She's like, I don't want to do surgery, period. I just don't want to do it. I don't get puffy. I don't cry. I don't retain water in my eyes. So I did a similar thing. I did filler beneath the fat pad to bring the skin up and camouflage the hollowness. I have a lot more. I do a lot of under eyes. I have a lot more, but these are just some that I had like kind of set up on my phone. So, if people have that protruding fat pad, I'm like, it will probably continue to protrude as you get older and sink down. So that's something to keep in mind. If you want to do surgery, I tell everybody, make informed decisions, not rush decisions. Here's what I can do. If I see their face, I'm like, look, I can show you some people that look like you. I've got thousands of consented photos of like, hey, this person reminds me of you. Here's the result. Do you like that? Is that what you're going for? Or do you want something more dramatic, less dramatic? We just have to talk it through. So here's one, same sort of thing. Did some filler to bring up the skin, camouflage the fat pad. And I mean, this is like, I don't want to say no downtime. Like, you could bruise, but it's like the next day you can wear makeup to cover. So it's not like you have to be out of work or anything. But if you do have something where I have to be on camera, maybe we'll do it on like a Thursday or a Friday. They'll take a day off, and then they have the weekend, ice, and then we really talk through the like prep before and after, avoiding blood thinners, avoiding alcohol, taking arnica, eating pineapple. All that helps minimize bruising and swelling and accelerate their recovery. So these are just some people's. I did the eyes. When I do the eyes, also I got to look and see if you have mid-face volume loss, if you're sunken through the cheeks. Sometimes we're doing a little bit of filler in through the mid-face to support, so it's not just the under eyes that are lifted and then this is saggy. Anything we do, we always want to make sure that, if we're treating one area, how does it impact another area? I don't want to just do cheeks, and then your sunken temples. That looks bad. Or lips, when you got these deep lines and your chin sits back and the lips protrude over your chin. That looks bad. So we're always trying to make sure that things look natural, that we're really considering how the face is aging underneath the skin. I'm not just chasing a line, guys. I'm like, where are we losing bone? Where are we losing volume? Where are fat pads separating and sinking? That is how the team and I inject so that it still looks like you and looks natural. Here's somebody younger. You can see she still has that little fat pad. We're just trying to camouflage it. We did a little filler. Here's some others. These are just some of the patients we've treated over. I've been doing this since 2013, and like I love it. Like I really want people to look natural and feel, fresh and never overdone. So I can flip through some of those. Let me see if there's other questions that I'm missing. Okay. Hollow eyes, scared of filler, high pockets, do the natural filler. So we were talking about that a lot. The natural filler is made completely from your own blood, your growth factors, your stem cells. This is from a live the other day. Somebody sent me like a weird hat. It made me laugh. Your growth factors and stem cells. There's no filler. There's nothing else mixed inside the tubes. Everything is made completely from your own blood and body. You're not going to have any allergic reactions to it. You're not going to have lumps and bumps that are staying around. You're not going to get swelling, puffing up and down. We've never had any issues with it with any of our patients, any part of the face. The patients really love it. It is not an overnight fix though. So if you want overnight, if you want quick, it's not the natural filler. That's when you go in with traditional filler. So this is why we'll just kind of talk through your goals and where you're at and what you're trying to achieve. Okay, let me see if, hey, Grace said, am I offering training? Right now, in this minute, no. I had like a whole mentorship program and that was great. But when I do stuff, girl, I give like 1,000,000%. And we had like 6 months. I had people and I would like train them in the office and meet with them online and help them with starting their practices. I think I did that at the beginning of this year or last year, but it was really great. It just takes a lot of time and like effort. So in this moment, I'm not. But if you ever have questions, if you're just like, what do I do? Call me, text me, and I will totally help you out. How long does nose slimming with Botox last? Like maybe 2 to 3 months. I don't think it's like a super big slimmer. This is filler for the nose. It's not I tell people with filler, even with Botox, it's not gonna be like super pinched in. Nothing is gonna make it super pinched in, but we can try to create a highlight down the center of the nose so it looks a little bit more contoured. We're building up the bridge. And your nose filler is gonna last, I say 1.5 to 2 years. Most of the patients come back and are like, Ginille, it's still hanging on. It's still like, she came back at 2 years and her nose was still perfectly straight. She was like, do we do more? I was like, no, leave it, let it be. So nose filler can last a long time. It can camouflage a bump. It can lift the tip of the nose. It can build up the bridge. We can do things for the nostrils. Some people want them more triangle or more round. It can prevent the nose from like curling down when smiling. So that's really nice. This is one of my patients I've had for a long time. She just did a big, like, I don't want to say, bodybuilding competition, and she did awesome. She's in Vegas. Okay. Okay, if you guys have other questions, please let me know. But I told you I'm not going to stay on super long tonight because I got to wash my hair, because I got to make videos tomorrow. I got to see patients tomorrow. And I've just been running with my kids all weekend and they've been crazy. If you have questions, you can always ask them here. I try to come live and like be here. You can always invite yourself in this box if you want, and we can do like a 1-to-1 here. Or, well, it's not 1-to-1. It's 1 to whoever's on live. And then you can always call or text my team so they see questions that go through and I see everything that goes through, and then booking a consult. We can do virtual consults or in-person consults. So you can do that at the top of my page. The number is on there as well, 424-218-4023. The link is there so that you can book a consult if you want. Brenda, are you talking about nose filler? Nose filler, 1.5 to 2 years that it lasts. A lot of people get longer out of it, but that's kind of what I say, on average. So she wanted her like tip upward. Some people want their tip to go up. Some people want it straight. Some people want to keep a little bit of their bump, but not all the way. She wanted, I feel like this is like a surgical result without having to go through surgery. I just really like the effects of it, and there's no downtime, and you can see the results right then and there. With the nose especially, like you might be a little swollen, but it's nothing crazy. Okay, if you have any questions, please, you guys know you can write to me anytime, but if I miss a DM, definitely look at the kids' drawings on the wall. Call or text the team, send us your pictures, set up a time to consult. I will be on here probably tomorrow. After consult, after patients. Can we see more ethnic noses? Yes, I flipped through some of them. We see everybody's noses here, but we have way more. If you want to, like, if you text the team, we can send them to you. These are just some that I have like on my phone that I try to prep before I go on live so I can like flip through. But for the noses, I tell people like it's not going to make your nose super pinched in. from the front, it'll look pretty similar. It'll build up the bridge and the highlight. You know, here she wanted her nose to not curve down when she smiled from the side. So these are all just some patients that you can see and like what we can do with the noses. How many sessions of PRF should you do in a year? So I tell patients if they're 20s to early 30s, do 2, spread them a month apart. If they are mid 30 plus, I would do 3, spread a month apart, retreating the same area. If you have a lot of volume loss, if you're like, oh, I lost, you know, some patients I've treated, some people I've treated, I've lost 100 pounds, I've lost 50 pounds, all that. Like, if you have a lot of volume loss, you're probably going to take more. But if you're just more preventative, say 2 to 3, you spread those like a month apart. And then, yeah, maintain. People come back a year later and they're like, I want to do that again. How much is filler for the first time for under eyes and lips? Lips, most people do a half syringe. I think it's a $575. A full syringe is $975, but most, like almost 9 out of 10 people in our clinic will do a half syringe first, let the lips kind of expand, let it settle, then we can build on it 6 to 8 weeks later. And then under eyes, I think it is $22.50 to $27.50. That covers 2 sessions. So we have you do it. We have you come back 6 to 8 weeks later. We retouch the same area. If we need to add more, if it's perfect, we don't have to. So it covers both sessions. And the under eyes, I say a year and a half to 2 years. I've only done my under eyes once, and that was over 10 years ago, and it lasted. And then I just kind of maintained with the natural filler. So under eyes hang on a long, long time, which is really good. But also why you need to see somebody who's doing this and not, like, if they're not doing it a lot, you don't want to see them because it hangs on a long time. If you've got a bad result, it's going to be there for a long time. Okay. And then ponytail lift with hyaluronic acid. Minimal. It's not going to be like crazy like that. But I mean, if these are just some of the patients, like you can see, with filler, what we're trying to do is create a highlight off the face. It's not like pulling you back, but we can make things look lifted with the lights and shadows. So like she's a good one, but like any of these patients, when we're treating their full face and not just trying to spot treat, which that's never our thing, but you know, her cheeks look lifted, soften smile lines, soften the corners of the mouth, you know, from the side from the side, you can see her jawline is extended and looks straighter. She's not having the jowls show. So we're really thinking about the full face when we do this. Okay, but it's not going to like lift. If somebody's like, oh my gosh, yeah, I tell people all the time, it's not going to pull you back like that. It's not that. It's not going to do that. That's where I'm like, hey, get a surgical consult. Like, just see what is natural filler. I'll do this one. And then what's the TikTok lady? That's Sujia. Yeah, she's made a bunch of videos we've been together for several years. She's made a bunch of videos kind of talking about what we've done. But we've done cheeks, smile lines, lips, corners of the mouth, chin, here. We've done Botox. We've done skin treatments. I love her. And I just appreciate her sharing it with people so they can see like Botox and filler and skin treatments, like it doesn't have to look crazy. Like you guys see her online all the time. She looks normal. Okay, so and then somebody said the natural filler. Natural filler. Oh, Barbara, that's cool. Thank you so much for sending that. Natural filler is made entirely from your blood. So we draw a couple tubes of blood, 2 to 4, depending on how many areas of the face we're treating. We spin it in the centrifuge, that's a spinner, and then it separates out your body's growth factors and stem cells. With that, we heat it and cool it so it thickens into a gel. Nothing else is mixed inside of it. It's just your body's stuff. Nothing else is mixed in it. Heat it and cool it, thickens to a gel, and then we can use that wherever in the face. So I did it yesterday. I've done this several times. I've been breastfeeding a 2-year-old baby, so I haven't had filler for over 3 years. But I did it yesterday, so I'm kind of swollen right now. I'm like, it's kind of weird to see my face like so puffy here. But I did temples, my eyes, my here, my corners of my mouth, my chin here. So wherever you place this, it's not for that instant lift. A lot of people think, oh, I only saw it. It lasted for 10 days. People will comment that I did that with my provider. I lasted 10 days. I'm like, your provider did not educate you enough, or you were not listening. This is not the instant lift. What we're going for with this is new collagen over time. So this is the long-term game. This is not the instant lift. This is going to make new collagen, elastin in the skin so that things will look softer over time. Guys, I didn't believe it either when I first started doing it because I'm used to getting an instant lift and doing filler. I've just been in the position where I can't do filler because I'm breastfeeding. I'm like, I don't look like I used to. Like I had that picture up earlier from when I was 28. I'm like, I don't look super sunken like I used to because I've been doing this natural filler. Okay, I'm going, yes, at Sujia. Was this with Botox? This was Botox, filler, skin treatments. We've done a bunch of stuff. And okay, I know there's somebody in there. I feel like I have a double chin. I just have, Bubby, can you, I can't do this right now because I have to go. But because someone said my face gets thinner, can we talk? I'll be on here tomorrow. Or Bubby, if you send me a picture, I can voice message you back. If you send me a DM and I'll send it, I'll talk to you on there. I'm 38, almost 39, interested in natural filler. I want to lose at least 20 pounds. So you can start the natural filler if you want, because as you lose weight, you're going to lose fat in your face as well. You're going to lose volume. So if you want to start earlier to like jumpstart that collagen stimulation and help you out so you're not so sunken, that could be a good thing. Or you can wait till after. It's up to you. You know, some people don't like the way their face looks when they start losing weight because they're like, oh, my eyes got hollow, my smile lines got deeper, the corners of my mouth got deeper, everything's kind of sinking. I've been hearing this a lot since, you know, weight loss medications have really, you know, taken an uptick the past few years, and they come in and they're like, what is going on with my face? I've lost 30 pounds, 50 pounds, 100 pounds. My face does not look like what I'm used to. So the natural filler, you can start earlier or you can do it later whenever it bothers you. But I do think it'll work well. If you lose a lot of weight and more volume loss, more fat loss in their face, you just might need more sessions. So that's something to keep in mind. Okay, I'm going to jump off, but what time tomorrow? Luna, I know, I wish I could like give a time. I always try to do it like when my kids are asleep or before I pick them up from school, but after patients. I think I finish patients around like 2:30 or 3, and I'll try to jump on if I can do it before I got to start doing pickups. If not, I'll do it like maybe after pickups and they're kind of quiet with daddy. I want Botox. I just have smile lines. Sujia, yes, that's Sujia. And we've done all the things. I'll message you. Yes, Bubby, message me. And I'll look at, if you message me there or you send me pictures, whatever, I'll look at and I'll send you a message back. I appreciate you guys. Thank you so much. I'm so sorry I didn't do the live with the people today, but I will talk to you soon. God bless you guys. Have a great night and